Amber light treatment produces hyperopia in tree shrews. My name is Safal Kanal, and I am a postdoctoral fellow in the School of Optometry at the University of Alabama at Birmingham. Previous studies have shown that exposure to narrowband red light promotes the development of hyperopia. Figure on the left shows the effect of red light in tree shrews. Figure on the right shows the effect on monkeys. As you can see, red light prevents emmetropization in infant tree shrews and produces hyperopia in both juvenile and adolescent tree shrews. In monkeys, red light not only produces hyperopia but also prevents the development of lens-induced myopia. These results suggest that red light could be a potential intervention for controlling myopia in children. But applying red filters is impractical in indoor lighting conditions and also difficult to tolerate for children because red filters reduce the brightness significantly. The use of amber light potentially addresses these limitations. Amber light also stimulates only the long wavelength sensitive cones as shown in the figure. Moreover, amber filters transmit significantly greater light than the red filters. So we asked, does amber light produce a similar hyperopic effect as red light? To answer this, we raised two groups of animals. The filter group of 8 animals received binocular amber light treatment through amber filters at the top of the cage for 11 days. The goggle group of 7 animals received treatment through the same amber filters fitted in a goggle frame. We compared refraction and ocular component dimensions in these two groups with standard colony raised animals. The figure on the left shows refractions over time, and the figure on the right shows vitreous chamber depth over time. Yellow triangles represent the filter group, yellow squares represent the goggle group, and the black line represents the standard colony group. During treatment, animals in the filter group became progressively more hyperopic with age. By end of treatment, they developed on average 3.5 diopters hyperopia. The hyperopia was primarily due to changes in vitreous chamber depth. By contrast, animals in the goggle group and colony group continue to show normal emmetropization. We suspect that goggles may have allowed small amount of white light to reach the eye from the periphery, and this may have negated the hyperopia-inducing effect of amber light. The hyperopia effect of amber light was similar in magnitude to the effect of red light reported previously. After treatment for 11 days, change in refraction from baseline was 2.3 diopters in red light versus 2.4 diopters in amber light. In conclusion, we found that exposure to amber light produces a similar powerful hyperopic effect as that produced by the red light. Since both of these wavelength conditions do not stimulate short wavelength sensitive cones, avoiding activation of short wavelength sensitive cone could be a key to producing hyperopia with long wavelength lights. Our findings suggest that amber light could be a potential pro-hyperopia anti-myopia treatment that is practical and clinically applicable in children.